Good evening. I'm going to present an overview of the so-called neglected tropical diseases. I will mainly talk about the general features, a general introduction about the topic, and about the challenges linked to dealing with those diseases. Neglected tropical diseases, as defined by the World Health Organization, are a group of 17 diseases divided into 4 groups according to the causative agent. They are caused by different microbes, helminths, protozoan, bacteria, and viruses. So they are very different in nature. Some are causing huge disability, and others are linked to even a high case fatality rate. Neglected tropical diseases, or NTDs, are causing a high burden of disease worldwide. In fact, there are over 1 billion people affected by one or more NTDs. You can see in this map the distribution of neglected tropical diseases at country level, and you will realize that the darker the color, the higher the number of diseases in a given country. You can see that the diseases are mainly distributed along the tropics and the subtropics, and it's mainly related to poor or very poor countries. There are 7 common features of NTDs. Let's see them. The first one is that they are diseases closely linked to poverty. In this map, you can see how the index of income is distributed along the planet. The blue areas are the areas with high income, and the purple and the yellow and the red, in the paler colors, represent the poorest country. So if you remember the previous map, you can see that there is almost a 100% match between the level of poverty and the burden of NTDs. These diseases also affect population with very low visibility. In fact, you can appreciate here a picture I took in South Sudan, in an area endemic for dracunculiasis, where you can see a young lady fetching water in a borehole, but look at the conditions that she needs to face or to handle to reach that borehole. It is also very important to bear in mind that people living in poor countries and in countries where NTDs are highly endemic are people with little political voice, and that is extremely really linked to the level of corruption in the countries. You can see in this map the Corruption Perception Index by Transparency International, and the more intense the colors with red have a higher level of corruption compared to the ones in yellow. Another feature of NTDs is that it's a group of diseases that, as a whole, they do not travel widely. This map shows the 35,000 routes between 4,000 airports worldwide. It's about 38 million flights and 3 billion passengers per year. So unlike flu, like H1N1, the possibility of a pandemic linked to NTDs is very low. That is why also little attention is given to them. Another important feature of NTDs is that they cause stigma and discrimination, especially of girls and women. Here you see a child from Syria, a young lady affected by cutaneous leishmaniasis. And in the map, you can see the representation of the gender gap. So countries in green uh, mean that there is has no gap or a very small difference between males and females, and countries that are pale green or orange are countries where the gap between males and females is huge, and you can see that is mainly in Africa and in the Middle East, most predominantly in the Muslim countries. However, it is important to notice that for most African countries, no data is available. Another important characteristic of these diseases is that they cause not only morbidity, not only disease, but also mortality. They can kill. That is the example of visceral leishmaniasis, or like in this picture, a sleeping sickness, human African trypanosomiasis. We see a patient very emaciated, very thin, affected by sleeping sickness, and on the bottom left part of the image we see a cemetery in Africa, in the Zandelan, a tribe that lives in Congo, Central African Republic and South Sudan, where the disease is highly endemic and thousands of people have died due to that fatal disease. Unfortunately, despite the high burden of disease and the stigma they cause, they are relatively neglected by research. In fact, in the period 1975-1999, only 1.1 of new therapeutic products had been developed for neglected diseases. In the period 2000-2011, a mere 0.6%, that is 5 out of 850 products, were registered for NTDs. And in the same period, only 0.3% of clinical trials were registered for NTDs. Despite all that dramatic scenario, I'm glad to share with you positive examples like this research unit of cutaneous leishmaniasis in Palestine. Last but not least, it is very important to remind that these diseases can be controlled and prevented, and in many cases using effective and feasible solutions that are easy and cheap to implement. For instance, this is an example of deworming. Just giving one tablet or a few tablets to children in a community, we can eliminate the disease. Diseases like helminthiasis, schistosomiasis. It can cost a few cents of a dollar to eliminate the disease in a country. And this is another example on the bottom right of the image, where we see a bucket covered by a piece of cloth, and if people from the endemic areas of Guinea worm use that filter to pour the water, they will prevent the infection of dracunculiasis. What are the challenges linked to NTDs in the areas where NTDs are prevalent? The first one is that those diseases are in areas where the access to healthcare is very challenging, is very difficult. This is one of the roads in South Sudan where we used to conduct active case search, active search of patients. We were going to the villages to look for patients, but sometimes, as you can see on the upper right image, we had to stop and clean ourselves the way to be able to proceed. In this picture taken for the plane, you can see how remote the villages are and how isolated. Sometimes we need to work in very hard conditions, and the people themselves, they live in very hard conditions. And this is an example again in South Sudan, in a swampy area where we had to walk several hours across the swamp to reach the community. And when you think that is difficult for you, look at this poor man that has to walk in the same environment, but he's missing a leg. Logistics is a key issue, and it's also very challenging. You can see this box is upside down because the termites ate the content. And you can see in the second picture that termites have basically destroyed very expensive medical material or even medicines that cost a long time and a lot of effort and money to reach to the hospital, but then the environment is not conducive to keep it properly. If I can summarize the challenges, in fact, I would say that not many things have changed. This is an image of around 1990 from the Zande tribe in South Sudan. And this is the same area a couple of years ago. So you can see that basically what has changed is the color. Now the picture is in color, but the living conditions are the same, and the lady has improved maybe by means of wearing a dress, but still barefoot and a very rural and tough environment. This is another picture from Africa, West Africa in 1930, where a team of laboratory technicians are doing the gland puncture to diagnose sleeping sickness. And that is how we are doing it currently in sub-Saharan Africa. This is a picture of a colleague where we are trying to find the parasite. Again, a picture of almost 100 of years ago, but very little has changed currently, and in this case we are even using a tank to work chart to have shelves, because we have to work in the middle of the forest. Insecurity is playing a very big role in how we can conduct operations. It's a main challenge, and in this map you can see the number of war and conflicts, armed conflicts that exist in the world. Again, you can realize that most of the countries affected by a war or conflict are the countries in the tropics and the countries highly affected by entities. This is an example from South Sudan with more than 1 million people displaced. And not only wars, also natural disasters like the earthquake in 2003 in Bam, where after 2 years there was an outbreak of cutaneous leishmaniasis. Thank you very much for your attention, and I hope you enjoy this briefing about NTDs.